Practical staging was asked, and one question on exchange transfusion, partial exchange transfusion. The formula was 80 into kg body weight into hematocrit observed minus expected divided by observed. The answer was 80 ml. And Carnicterus baby, what is the investigation that you do? Bera. Vitamin E deficiency in premature baby anemia was asked, and one more clinical scenario which was suggestive of vitamin E deficiency was there. Crickets. This question is little dicey. Please do comment if any one of you know the correct answer. The question included, despite of giving vitamin D, there was no response. That was the question, with values showing calcium of 10, phosphorus 4, and parathermone normal, and VBG showing pH of 7.35. 7.35, it is exactly at the borderline, and there was no clinical history suggestive of distal RTA as far as I remember. I have marked it as hypophosphatemic because Nelson's value of phosphorus in pre-adolescent childhood age group was 3.7 to 3.8 is the lower limit, and this was 4, so I don't know what's the answer. Please do comment if any one of you know the correct answer. And next question on chronic kidney disease, why hyperkalemia happens. There are many pathophysiological mechanisms, but the best answer would be, as per Nelson, increased net acid level. That's the answer. And next question, parathormone statement was there. Does that act on tubules? No, it does not act on tubules for phosphorus reabsorption. So that's the answer. Next was an image based question on fundus image of retinitis pigmentosa, and that was the options given were arteriolar attenuation and optic disc waxy pallor and proliferation of vessels or something. Cherry red was there, and pigmentation was there, one of the option. I have marked it as pigmentation. Actually, it's a triad of bony spicule pigmentation and arteriolar attenuation and waxy optic disc pallor. So I do not know what would come as the answer. Next image question on cherry red spot was there, and MPS investigation line, that is clinical history and examination, and then followed by that will be our urinary gags, serum gags, enzyme assays, and then we go for genetic analysis. That's the sequence. 92nd question, that is there was a clinical scenario suggestive of hyperammonemia, increased lactates to pyruvate levels was all given. I have marked it as CoQ deficiency. Should wait and see for the answer. Next question on osmotic diarrhea, it was glucose and galactose. And drug induced liver injury, answer is carnitine. And one clinical scenario with lymphedema with features of conjugated bilirubinemia, the answer is Agnès syndrome.